Hi everyone! In today's clip, I will talk a little bit about varicose veins. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So varicose veins are enlarged, twisted, often bluish-purple veins, usually happening in the legs due to weakened or damaged vein valves. Normally, valves prevent blood from flowing backwards. When they fail, blood pools in the vein, causing it to enlarge. Things that we blame for this ailment are genetics, family history, not a believer in that, age, not a believer in that, hormonal changes like pregnancy, menopause, birth control pills, prolonged standing or sitting, obesity, and sedentary lifestyle. So conventional treatments for this usually are compression stockings to improve blood flow, to reduce swelling and relieve the symptoms, leg elevation, sort of to encourage venous return, exercise like walking, calf raises, cycling to boost the circulation, weight management to reduce pressure on the veins. However, these are not cures, only control of symptoms. As for medications to manage the symptoms again, they will prescribe things like diosmin or hesperidin, which are flavonoids, to improve venous tone, reduce inflammation and edema. The side effects are gastrointestinal upset, headaches, and allergic reactions. They also will bring in NSAIDs like ibuprofen, naproxen for pain and swelling. Side effects are, of course, GI bleeding, kidney and liver strain, and heart risks with long-term use. It also has interactions like increased risk with blood thinners, warfarin and aspirin, as well as steroids. They provide blood thinners like heparin, warfarin, and the new DOACs, or direct oral anticoagulants, which are a class of drugs that prevent blood clots by inhibiting specific clotting factors in the body. Side effects: excessive bleeding, bruising, interactions with many drugs, as well as antibiotics, alcohol, herbal supplements like ginkgo biloba or garlic or St. John's wort. Then there's sclerotherapy, which is the injection of a solution to collapse vein. The risks are skin irritation, hyperpigmentation, allergic reactions, possibility of blood clots. Then they have endovenous laser ablation, or EVLA, which is minimally invasive medical procedure that treats varicose veins by delivering laser energy into the damaged vein to collapse and seal it. It will seal it shut, redirecting the blood flow to healthier veins. The risks with these are bruising, nerve injury, skin burns, and clot formation. Then they have ambulatory phlebectomy, which they make tiny incisions to remove surface veins, basically. And the risks are scarring, infections, and nerve damage. Then they have vein stripping or ligation. This is an outdated, invasive sort of surgical procedure to remove large varicose veins by making incisions, tying off the vein, and then pulling it out with a wire instrument. The risks of this, of course, is in the fact that it is invasive and it has a much longer period of recovery. On the holistic and natural approaches and nutritional and herbal supplement side of this, horse chestnut extract improves vein tone, reduces swelling, but do not take this with anticoagulants because it increases the risk of bleeding. Goji kola, which supports connective tissue and circulation. Butcher's broom, which reduces swelling, improves blood flow. Pycnogenol, which is pine bark extract, basically, It strengthens capillaries and is an antioxidant. Bioflavonoids such as citrus, berries, rutin, quercetin, and they reduce permeability and strengthen the vein walls. Omega-3 fatty acids, which improve circulation and reduce inflammation. Practicing yoga poses, so the legs up the wall, which helps Venus return, and massages, but gentle, not deep on veins, and that improves circulation. Then there's cold shower, contrast sort of hydrotherapy, which involves alternating immersion in hot and cold water to reduce inflammation, pain, swelling, and also promote tissue healing and improving recovery after intense physical activity. Avoid prolonged sitting and standing. Take breaks and flex the calf muscles. The vitamins and minerals that sort of support this include vitamin C, 1,000 to 5,000 milligrams a day. This is for collagen formation and strengthening of the veins. Vitamin E complex, 200 to 400 international units a day. It will improve circulation, and it also has anticoagulant properties, so be cautious if you're taking blood thinners. Magnesium complex, 200 to 400 milligrams a day to relax the vessels and reduce cramping. Zinc and copper to support tissue repair and to strengthen weakened vein walls, making them more rigid and less likely to bulge. On the emotional and metaphysical causes of this ailment, we can look into sort of blocked flow being equal to blocked emotions. Veins carry blood, which is the life force. When it's blocked, it may reflect blocked joy or stagnation in life. Also, varicose veins are linked with feeling overworked, overstressed, or stuck in a situation, whether it is job, relationship, duty, whatever. So holding resentments, feeling heavy with responsibility also causes that. Lack of movement, symbolizing lack of progress in life. So always remember that the emotional side of the ailments would need to be addressed before any cure can come about. And it is always best if you heal with that part first and clear the pathways before taking physical actions, or at least simultaneously. Do it simultaneously. Hope this has been helpful. Like and follow for more. Be the light.